know your numbers. Just
Yeah.
know what your blood pressure is. Even if you don't do something about it immediately, you're aware of it, and you should then maybe, hopefully, have a healthier lifestyle to
I
really.
I did an interview with a professor who's in a discipline I'd never heard of. He's actually the CEO and chairman, so he's a PhD in an area called silicon photonics. And he's the chairman of a company in London called Rockley Photonics. And they basically shrink benchtop medical equipment into sensor technology that's about to go in the next version of smartwatches. And they're working with Apple. And he said to me that they've invented this. It's like light technology with some sensor technology combined. It's very complex, but they've invented a technology that gives clinical standard blood pressure readings from a sensor in a smartwatch so that you can see your blood pressure without a cuff, like 24 hours a day. Would that be an advantage for people to be able to know that?
I want to spend a few minutes on this topic. It's a
Okay.
very important point that you're raising. I'm working in this space a lot because I'm also an authority in internationally on checking whether devices are accurate.
Okay,
Right?
good.
This is something that's completely misunderstood. Even I will talk about the wearable devices. So it's like this Fitbit type of
The current
devices.
one, yeah. This is not out there
But
yet.
this is a new technology. Yes, yes. So for standard devices that we can buy in the pharmacy, so we often firstly recommend people to measure their blood pressure at home. It's much more accurate than the ones that the doctor measure because you're anxious there. Often
Yeah.
people are anxious. We call it the white coat effect, and then it's very high, and you don't know whether it's really high or whether it's because you're a bit stressed or whatever. So we recommend, if it's in your family, to get a device at home and to measure it twice in the morning and twice in the evening. Keep record of it, and if it's high, then you go to the doctor with those values.
Yeah.
And high is 100. Maybe I can just explain the numbers.
Yeah.
High is higher than 135 or for the top number, and higher than 85 for the bottom number. If it's higher than that consistently, you may likely have hypertension, and therefore then take that data to the doctor to evaluate it further. The problem is when we advise people to buy a device, 80% of devices in Australia are not checked for accuracy. Right.